Doctor's office visits for flu are as high as we saw in the peak of the 2009 influenza pandemic. Hospitalizations right now are as high or higher than we've seen in our most recent severe season, the 2014-15 season. The flu season could last several more weeks. What we've seen in the past 5 years is an average of 16 weeks of elevated influenza activity, and we're only at week 11 right now. In severe seasons in the past, over 700,000 people have been hospitalized and 56,000 people died from influenza. We may be on track to reach or even exceed those records. So exactly why we're having such a severe year is difficult to say. It may be a combination of factors: the virus, the weather, it may be the early season that we saw. Disease started to increase earlier this past fall, and so we may have a longer season by the year's end. We know that many people have been vaccinated. We don't know yet exactly how well the vaccine is working against all the different types of flu strains that are circulating here. We still recommend influenza vaccination. Some protection is better than none, and it's not too late to be vaccinated if you haven't been vaccinated yet this season. We're seeing intense influenza activity in most states around the country, and even seeing some spot shortages of antiviral medicines. We think it's very important for people who have heart disease or lung disease, or who are pregnant or very old or very young, who get sick with flu symptoms, to promptly seek care and benefit from antiviral medicines. This is a difficult season, but there are things that everybody can do to reduce your risk of flu and reduce the risk that you may spread this to someone else. Wash your hands frequently. Cover your nose and mouth when you cough or sneeze. And if you are sick, please stay home from school or work. The mild illness that you have might be a much more severe illness in someone else.